Hi to all participants. As a reminder, please scan the QR code for registration. Thank you. And after this, we will do the mic testing for each of participants. Thank you. Okay, so hi, we will do the mic checking for each participant for each team. When I read your ID name, please respond to me by saying yes or anything. So we will start with Taylor, Team A.
Hello.
All right, so A1, Taylor, do you mic?
Yes.
Yes, okay, thank you. A2, Taylor.
Yes, here.
A3, Taylor.
Yes, I'm here.
A4, Taylor.
Yes, I'm here.
Second team, UOC Team A. So A1 UOC.
Yes, I'm here.
A2 UOC.
Yes.
A3 UOC.
Yes, present.
A4 UOC.
Yes, here.
IMU A1.
Our A1's not participating this round.
Oh, so your team have four people, right?
Yes, A2, A3, A4, A5.
Oh, all right.
Yeah.
So A2,
Yes.
A3, A3 IMU. So A3 IMU not here. Proceed to the A4 IMU.
Yes, I'm here.
A5 IMU. A5. All right. So next for IIUM team A1 IIUM,
Yes.
A2 IIUM,
Yes, yes.
A3 IIUM,
Yeah.
A4 IIUM,
A4 is not playing in this round. A5.
oh, so A5. All right. So A3 IMU not here yet. Let's wait for him. So A3 IMU, are you here?
Sorry, I think you might have to wait for a little. I think she got into the wrong room.
Oh, okay. We will give you for 3 minutes. That's all right.
All right, I'll rush her.
Hi, I'm Jennifer. I'm in the call.
All right.
Sorry.
Thank you.
Yeah, A5MU also in. Okay.
All right. Give me a minute.
Good.
So hi everyone. Semi-final round will begin shortly. So everyone, please be prepared. Hi Assalamualaikum and good afternoon to judges and fellow participants. Welcome to the semi-final round of the first MyPSA National Pharmacy Quiz Challenge 2021. I am Ansha and my partner Sharon will be co-moderating this session today. In this session, we have Taylor's University, Team A, UOC Team A, IMU Team A, and IIUM Team A. We are also honored to have Dr. Shamin, Dr. Nafis, Dr. Nurul Ain, and Dr. Abdullah Khan as our judges in this session. So before we begin, I will be recapping some of the rules and regulations of this round. In this round, all questions will be oral-based short answer questions. And I will draw the number of questions from this container. And my partner will share the question on the screen. Marks will be taken by the judges. In this round, each team will be answering 2 questions per participant, which is 8 questions per team. Each correct answer will be awarded 5 marks. In this round, challenge and chance mechanism will be applied. Question will be read twice after it is shown on the screen. Participants are given 1 minute 15 seconds or 75 seconds to answer the questions. Take note that participants need to prepare stationeries such as A4 paper, calculator, and pen to answer the questions that require sketching or calculation in this semi-final round. I will explain about challenge mechanism first. Once Team A, which is the answering team, has given the answer, the other challenging team, Team B or C or D, is allowed to challenge the answers given by typing challenge in the chat box during the given time by me. If the challenging team has a more accurate or a correct answer, the challenging team will obtain double the original marks, while the answering team obtains 0 marks. However, if the challenging team provides a less accurate answer than the answering team, they will obtain 0 marks, while the answering team obtains 2.5 marks. Participants can challenge other team by typing challenge in the chat box in my count of 5, 4, 3, 2, 1, like that. Next is the chance mechanism. If the answering team was unable to provide the answer, they may designate another challenging team, Team B, C, or D, to present their answer. If the answers given by the challenging team is correct, the challenging team obtains full marks while answering team obtains 0 marks. However, if the challenging team provides a wrong answer or could not answer the question, the answering team will obtain 2.5 marks while the challenging team obtains 0 marks. Throughout the entire round, each team can only designate another team once. And also throughout this round, participants are allowed to discuss among teammates using any type of communication method in 75 seconds. Participants are required to switch on their camera and mute their microphone throughout the round, except during your turn. Now, I've done explaining the rules and regulations. Then we will start with Taylor's University A1. So, I will draw the number of questions from this container, and my partner will share the question on the screen. So the first number of question is 11. 11. So the question is, list the advantages of social health insurance model in healthcare financing. I repeat, list the advantages of social health insurance model in healthcare financing. Your 75 seconds will start from now. So A1 Taylor, your time is up. You may switch on your microphone to answer the question.
If we like to use the chance, then we can use it now, right? But only once, right?
Yes. So if you which university do you want to give the chance?
Uh, UOC then, yeah.
Okay, so UOC, you were given a chance to answer this question from A1 Taylor University. So please open your mic to answer the question. Hello, UOC.
Hi, can you all
Yeah.
hear me?
Yes.
So list the advantage of social insurance model in healthcare financing. The first will be perceived as a benefit tax with more willingness to pay. Second, is it a number? Is it like a number like or how many advantages also okay?
Or anything. Just
Okay. So mandatory contribution based on ability to pay. Protects health financing from government annual budget process. Additional health revenue source. More ways to fund medical care. Risk in pooling. And earmark benefits. Promote social solidarity and can bargain better vice providers. Example, a single payer. Yeah, that's all from us.
okay, thank you for your answer. And let's proceed to the second question for A1 Taylor again.
That's it, right?
So the number of question is number 1. Number 1. So the question is, list 5 examples of parental roots. I repeat, list 5 examples of parental roots. Your 75 seconds will start from now. Okay, so A1 Taylor, please switch on your microphone.
Okay, hi. So the 5 examples of the parental routes are intramuscular route, intrathecal route, intravenous route, subcutaneous route, and intradermal route.
Okay, so thank you for the answers. And other universities, do you want to challenge the answers given? If you do, you may type challenge in the chat box in count of 5, 4, 3, 2, 1. So there's no one to challenge. Then let's proceed to the next participant, which is A1 UOC. So I will draw again from this container. So the number of question is number 3. Okay, so the question is, State the characteristic of full pharmacoeconomics evaluation. I repeat, state the characteristic of full pharmacoeconomics evaluation. Your 75 seconds will start from now. Okay, so your time is up. May I know your answer?
Okay, the answer for the characteristic of full pharmacoeconomic evaluation, the costs and outcomes are considered and compared. And number two, at least two options are compared, which is pharmaceutical products, pharmaceutical services, and interventions. Number three, one of the options in the comparison can be without option. For example, doing nothing. That's my answer.
Okay, so thank you. Other universities, do you want to challenge the answers given? If you do, you may type challenge in the chat box in count of 5, 4, 3, 2, 1. So there is no one to challenge. So let's proceed to the second question for the same participant. So the number of questions for A1 UOC is 45. So the question is, name the 5 factors to consider when designing a dissolution test for a tablet formulation. I repeat, name the 5 factors to consider when designing a dissolution test for a tablet formulation. Your 75 seconds will start from now.
Okay.
Okay.
Okay, for the answer for factors to consider when designing a dissolution test for tablet formulation, the 5 factors are the size of the container, the nature of the agitation, the temperature, viscosity, and volume.
Okay, so thank you for the answer. Other universities, do you want to challenge the answers given? If you do, you may type challenge in the chat box in count of 5, 4, 3, 2, 1. Thank you. Let's proceed to the next participant, which is A2IMU. So I withdraw the number of questions from this container. So the number of questions is 55. So the question is, what are the mechanisms involved in regulating total plasma volume? I repeat, what are mechanisms involved in regulating total plasma volume? Your 75 seconds will start from now. So your time is up. You may switch on your microphone to answer the question.
Okay, so blood volume is mainly determined by the amount of water and the amount of sodium ingested in the body, and it's mainly regulated by the renal system, excreted by the urines and into the form of urine, and it could be lost through the GI tract, lungs, and not skin. So to maintain blood volume within a normal range, the kidneys will regulate the amount of water and sodium loss in the urine. So the mechanisms which are involved in the regulation will be the renin-angiotensin-aldosterone system and the antidiuretic hormones, where the aldosterone will stimulate the uptake of the sodium and the antidiuretic hormone will regulate the sodium concentration indirectly by regulating the reabsorption of the water.
Okay, thank you for the answer. Other universities, do you want to challenge the answers given? If you do, you may type challenge in the chat box in count of 5, 4, 3, 2, 1. Okay, so thank you. And let's proceed to the second question. So the second question is 2027. So the question is, state the most suitable nicotine replacement therapy products for a highly dependent smoker. I repeat, state the most suitable nicotine replacement therapy products for a highly dependent smoker. Your 75 seconds will start from now. Okay, so your time is up. May I know your answer?
Okay, so for highly dependent smoker, it will be best for them to use a combination therapy, which includes a nicotine patch and also the gum or nicotine nasal spray, which is more efficacious compared to only a single form. So they are for highly dependent, it's recommended to have both. And the nicotine gum should be 4 mg. So by this combination, the patients will be more be more able to stop smoking. Yeah, combination between patch and gum.
Thank you for the answer. Other universities, do you want to challenge the answer given? If you do, you may type challenge in the chat box in count of 5, 4, 3, 2, 1. So A3RIUM want to challenge, so you may switch on your microphone to answer the question.
Hello? Yes.
Yes.
So for highly dependent smokers, the most suitable nicotine replacement therapy is combination therapy of firstly nicotine patch, dosage form 25 milligrams. For one patch can last for 16 hours. Apply to be applied during waking up, and for the period between the patches, give 4 milligrams nicotine gum for cravings between the periods. I think that's all.
Okay, thank you for the answer. And let's proceed to the next participant, which is A1RIUM. So I will draw from this container again. So the number of question is 48. 48. So the question is, based on the diagram, sketch roughly the mass spectra of the compound. I repeat, sketch roughly the mass spectra of the compound. For 75 seconds, we'll start from now. Okay, so your time is up. May I know your answer?
Okay, that's if you can see on the, oops, tak ada. Macam nak ni, kena buang background. Kena buang background. Wait. Okay, if you can see here on the camera, we have y-axis and x-axis. We have 3 bars here representing the mass of the positive ions produced. So here we have 3 values here to represent their molecular weight. The first one is 12, the first bar. The second bar is 29, and the third bar is 77, representing the aromatic portion. That's all.
Okay, so thank you for the answer. Other universities, do you want to challenge the answers given? If you do, you may type challenge in the chat box in count of 5, 4, 3, 2, 1. Okay, then let's proceed to the second question. So the question is, number 8. 8. The question is, explain the principle of NMR spectroscopy. I repeat. Sorry.
The judge wants me to repeat the answer.
Oh,
the
really? All right.
question.
All right.
I can do the favor. Can I repeat the answer?
Yes.
Okay, thank you. If you can see here, I'm showing a mass spectrum here, mass spectrophotometry here. You can see the x-axis and y-axis here, and we have 3 peaks here showing the respective molecular weight. So namely, the first one is the first peak is the value is 12. The second one is 29, representing the CHO. And the third one, the last peak here is the 77, which represents the aromatic portion of the compound that the moderator showed me earlier. That's all.
Okay, so judges, are you clear? Okay, thank you. And let's proceed to the next question, which is question number 8. Okay, so the question is, explain the principle of NMR spectroscopy. I repeat, explain the principle of NMR spectroscopy. Your 75 seconds will start from now. So your time is up. May I know your answer?
Yes. Okay, so in an atom, we have a nucleus consisting of proton and neutron. So in nature, nucleus will be spinning and creating its own small magnetic field. So when we were to apply the external magnetic field, so it will cause the resonance or causing the nucleus of an atom to become more excited. So as time passes by, the nucleus become less excited. Therefore, it will emit the energy produced earlier when it received the external magnetic field, causing the observer can read the reading through the NMR spectrum. And from the spectrum, we can identify the types of the number of neighboring atoms produced available. For instance, we have several examples such as 13 carbon NMR as well as 1 hydrogen NMR. Another thing to consider during the nucleus spinning part is that the nucleus is also protected by the electron, which possess the diamagnetic shielding. It will cause we need higher external magnetic field to be applied to create the resonance. That's all from me. Thank you.
Okay, so thank you for the answer. Anyone, other universities, do you want to challenge the answers given? If you do, you may type challenge in the chat box in count of 5, 4, 3, 2, 1. So A1 Taylor University want to challenge. You may switch on your microphone to answer the question.
Okay, thank you. So For NMR spectroscopy is a form of spectroscopy, and spectroscopy actually involves the interaction of the electromagnetic radiation with matters. And while for the principle of the NMR, the principle behind the NMR is that there's many nuclei that have spin, and all nuclei are electrically charged. And if an external magnetic field is applied, an energy transfer is possible between the base energy to a higher energy level. And the energy transfer normally takes place at a wavelength that corresponds to the radio frequencies, and when the spin returns to its base level, and the energy is emitted at the same frequency. And another principle of NMR spectroscopy is the signal that matches with this transfer is measured in many ways and processed in order to yield an NMR spectrum for the nucleus concerned. And other than that, Schulleri rules is also applied in NMR, which is an empirical rule to compute the approximate chemical shifts for multiple substituted system. And that's all for my answer. Thank you.
Okay, so thank you for the answer given, and I will give 10 seconds for judges to mark the answers. Okay, so let's proceed to the next participant, which is from A2 Taylor. So again, I will draw from this box, from this container. So the question number is number 6. So the question is, explain the term orphan drug. I repeat, explain the term orphan drug. Your 75 seconds will start from now. Okay, so your time is up. You may switch on your microphone to answer the question.
Okay, so according to the US FDA, an orphan drug is defined as like one intended for the treatment, prevention, or diagnosis for a rare disease or condition, which is one that affected less than 200,000 persons in US. Yeah, so it also means need cost recovery provisions of the act. So in European Union, the European Medicine Agency EMA defines that orphan drug is actually intended for life-threatening or chronically seriously condition affecting not more than 5 in 10,000 European Union people. So EMA also qualified that a drug as often if without incentive, it would be unlikely that marketing the drug in the European Union would generate sufficient benefit for the affected people and for the drug manufacturer to justify the investment. So for example, the example for orphan drug is like the drug treat malaria. Yeah.
Okay, thank you.
Yeah.
So other universities, do you want to challenge the answer given? If you do, you may type challenge in the chat box in count of 5, 4, 3, 2, 1. Okay, so A3 UOC want to challenge the answers given. So you may switch on your microphone to answer the question.
Hi, thank you. So definition for orphan drug will be a medicine that has been developed specifically to treat rare medical conditions. So these medical conditions are normally referred to as rare diseases, and there is much current interest in development of the orphan drugs for the treatment of such diseases. So orphan drugs generally, they still follow the same regulatory development path as any other pharmaceutical product as well. So example of one orphan drug would be the trade name Cofactor. And to also add on to it is that the FDA currently has approved 600 orphan drugs, and since the passage of Orphan Drug Act. Yeah, and that's all from me. Thank you.
Okay, so thank you for the answer. I will give 10 seconds for judges to take their marks. So I will proceed to the second question for A2 Taylor. So the number of question is 32. So the question is, write 4 analytical techniques used in pharmaceutical science. I repeat, write 4 analytical techniques used in pharmaceutical science. Your 75 seconds will start from now. Okay, so your time is up. May I know your answer?
Okay, so spectroscopic analysis, diffractometric analysis, thermal investigation, surface analytical techniques, particle size analysis. Then the examples are Fourier transform, infrared spectrometer, nuclear magnetic resonance spectrometry, then mass spectrometry, then thermal analysis spectrometry. Then the examples are differential thermal analysis, isothermal microalorimetry, thermal gravimetry analysis, differential scanning calorimetry, and then UV visible spectrometry, and then chromatography like HPLC, TLC. Yeah.
Okay, so thank you for the answer. Other universities, do you want to challenge the answers given? If you do, you may type challenge in the chat box in count of 5, 4, 3, 2, 1. So there is no one to challenge. I will give 10 seconds for judges to take their mark. Okay, let's proceed to the next participant, which is A2 UOC. So the number of question is 41. Okay, so the question is, briefly describe any 5 out of the 7 steps of hand washing in aseptic practice. I repeat, briefly describe any 5 out of the 7 steps of hand washing in aseptic practice. Your 75 seconds will start from now. Okay, A2 UOC, all right.
By stating different 5 out of 7 steps of hand washing technique in aseptics, starting with rubbing the hands together like this, and also rub the back. The second step is rub the back of both hands. Can you see? Oh, okay. And also like the third step is interlace both fingers and rub hands together like this. Join the fingers together so that you can clean the group of the fingers. And also like lock the fingers together for interlock, and then rub the back of the fingers which you might miss of both hands. And also like a fifth step is rub the thumb in a rotating manner, following by the area rubbing by index finger and thumb for both hands. You have to use soap for all these steps beforehand also. Yeah. These are the 5 steps.
Okay, thank you for the answer.
Washing. Yeah.
Ada Eustace, do you want to challenge the answer given? If you do, you may type challenge in the chat box in count of 5, 4, 3, 2, 1. So F4 Taylor want to challenge the answers. You may switch on your microphone to answer the question.
Okay, so for the steps of hand washing in aseptic practice, firstly, we need to remove our hand accessories, like for example, our watch and our bracelets on our hand. Then followed by we need to turn on the faucet using a paper towel. Then we need to switch on the tap and wet our hands and apply it with liquid soap. After that, we need to work the soap into a lather and scrub our hands for at least 2 minutes. After that, we need to keep our hands at a lower angle than your elbows to prevent the dirty water from running back onto your arms. The next step will be to interlace your fingers to clean between them to prevent any dirt from stuck in them. Then we need to scrub our fingernails with a nail brush to remove the dirt from it. Then we need to dry our hands with a clean paper towel. And finally, turn off the faucet using a clean paper towel. So that's all from me. Thank you.
Okay, so thank you for the answer. I will give 10 seconds for the judges to take their marks. Okay, let's proceed to the second question for the same participant, which is A2 UOC. So the question is 40. So based on the diagram, which of the following functional groups will have a fundamental vibrational frequency with the highest wave number? Justify your answer. I repeat, which of the following functional groups will have a fundamental vibrational frequency with the highest wave number? justify your answer, and your 75 seconds will start from now. Okay, so your time is up. You may switch on your microphone to answer the question.
Oh, hi everyone, it's me again. The functional groups that has fundamental frequency with the highest wave number, in other words, frequency is its third. So the third one with triple bond, fundamental vibrational frequency, to define it, it's of a molecule. It corresponds to like transition from V equals to 1 and or to V equals to 0 to V equals to 1. For non-linear molecule, there will be by 3n to 6, where n is the number of atoms, number of vibrations. So in this case, it represents the vibrational quantum energies. I mean, quantum numbers represented by the potential energy for harmonic oscillators. So in other words, the more bonds it has, the higher the energy it needs to like have a same frequency to resonate. So in this case, wave number represents the more the wave number, the higher the frequency, the more wave contained in one stretch of space. So that means higher energy. So the highest energy needed to break the 3 bonds, I mean need to vibrate and resonate with 3 bonds, is none other than the molecule, which is C triple bond C, L. Okay, doesn't matter. Alkyne. Okay, and yeah, that's that. That's the point.
Okay, so thank you for the answer. Other universities, do you want to challenge the answer given? If you do, you may type challenge in the chat box in count of 5, 4, 3, 2, 1. So I will give 10 seconds for judges to take their mark. Okay, so let's proceed to the next participant, which is A3IMU. A3IMU. So I will draw the number of questions from this container, and the number of question is number 19. 19. Okay, so the question is, state the main components of K-Smith system. I repeat, state the main components of K-Smith system. Your 75 seconds will start from now. Okay, so your time is up. May I know your answer?
May I give this chance to another university to answer it?
Okay, so which university do you want to give a chance?
Maybe to IIUM.
Okay, so IIUM, you have given the chance by A3MMU to answer this question. So you may switch on your microphone to answer the question. So IIUM, are you there?
Yes, hello.
Okay.
So the main components of case mix system are demographic characteristic, diagnostic characteristic, and therapeutic characteristic. That's all.
Okay, thank you for the answer. I will give 10 seconds for the judges to take their mark.
A3 IIUM, can you repeat your answer?
Yes, sir. The main components of case mix system are diagnostic characteristic, demographic characteristic, and therapeutic characteristic. That's all.
Okay, so thank you. Let's proceed to the second question for A3IMU. So the question is 26. So the question is, list 5 major sources of variability in drug response. I repeat, list 5 major sources of variability in drug response. Your 75 seconds will start from now. Okay, so your time is up. May I know your answer?
Okay, so the variability includes like genetic factors of the patient, like the drug target and how does the drug transport in the body, or environment factors like the drug ability to inhibit or cause induction, or any related factors such as age or the disease, and also include the pharmacokinetic profile of the like including how the drug is metabolized in the person's body and how is it absorbed and how is it distributed in the body and how is it eliminated. So all of these examples will cause the variability in the drug response.
Okay, so thank you for the answer. Other universities, do you want to challenge the answer given? If you do, you may type challenge in the chat box in count of 5, 4, 3, 2, 1. So I will give 10 seconds for judges to take their marks.
A2UOC would like to challenge, right?
Oh yes, but I didn't do it at the countdown.
Oh.
No worries.
If you have the answer, just go ahead.
Oh, okay. If I had to answer, the variation in drug response depends on a few things. Aside from disease, age, genetic factors, which affects how the body responds to the drugs, comorbidity, and diet also, they affect the drug response because absorption and pharmacokinetics factors depends on that. And also like patients totally non-responsiveness, sometimes in certain cases such as anti-seizures, also with a lot of side effects, those drugs can affect the compliance and thus varies in drug response. And also in the individual variability comes down to the differences in receptor numbers and structures and receptor coupling mechanisms, physiological changes in target organs that result from differences in genetics, age, and health. So all these pharmacogenetics factors also affects the way such as genetic polymorphism, as we know that it affects the manufacturing of enzymes, which affects the metabolism of different numbers of enzyme per ml of blood. I mean, in the body will be generated in different quantities. So that leads to pharmacogenetics differences, and also like different races. As we know that the enzymes generated by different races, levers, are totally different. So yeah, that creates a very huge multifactorial pharmacogenetics differences in variations of various drug response. Thank you.
Okay, so thank you for the answer. I will give 10 seconds for judges to take their mark. Okay, so let's proceed to the next participant, which is A2IIUM. So the first question for A2IIUM, the number is number 12. So the question is, list possible side effects of long-term corticosteroid therapy. I repeat, list possible side effects of long-term corticosteroid therapy. Your 75 seconds will start from now. Okay, so your time is up. May I know your answer?
Okay, thank you. So for list of the possible side effect of long-term corticosteroid therapy, the first one is immune suppression. Second, adrenaline insufficiency. Next, Cushing syndrome, osteoporosis, and hirsutism. I think that's all.
Okay, thank you for the answer. Other universities, do you want to challenge the answer given? If you do, you may type challenge in the chat box in count of 5, 4, 3, 2, 1. So
I'm you, yeah. If I
yes,
am you, want to. Yeah,
yes.
so basically, corticosteroid long-term side effect is depend the dosage form that you take. For example, if you take the inhaled corticosteroid, the long-term side effect might be the oral thrush. If you take the injected corticosteroid, right, it will cause the stomach irritation and swelling in the site of injection. But when you take the oral corticosteroid, it will bring more side effect compared to you take the inhaled and also the injected. For example, if you take the oral corticosteroid, you may get the osteoporosis, hypertension, diabetes, weight gain, thinning of skin, and muscle weakness, etc. Thank you. That's all.
Okay, thank you. I will give 10 seconds for judges to take their mark. Okay, so before we proceed to the next participant, I would like to remind all participants to challenge within 5 seconds in count of 5 that I said. And before, if you type challenge before or after the 5 seconds, your challenge is not going to be valid. Okay, thank you. And let's proceed to the next participant, which is A3 Taylor.
Sorry, I just
Sorry. Sorry. For the second question for A2 IIM. Sorry. So the question is, number 20. Okay, so the question is, several tricyclic antidepressant like amitriptyline and dozepine may cause anticholinergic effects. So what are the symptoms related to this effect? I repeat, several tricyclic antidepressant like amitriptyline and dozepine may cause anticholinergic effects. What are the symptoms related to this effect? Your 75 seconds will start from now. So your time is up. You may switch on your microphone to answer.
Okay, thank you. So the first one will be tachycardia, next dry mouth, third blurred vision, fourth dilated pupil, fifth hypersalivation.
Okay, thank you for the answer. Other universities, do you want to challenge the answer given? If you do, you may type challenge in the chat box in count of 5, 4, 3, 2, 1. So Taylor University A3 want to challenge the answer given. So you may switch on your microphone to answer.
Okay, thank you. So to further classify the side effects, it can be classified into, for example, peripheral side effects, which include like decreased salivation and all the dry effects such as decreased sweating, and also some effect on the eyes like increase the pupil size, and of course also increase heart rate and decreasing urination, and also gastric motility. And there are also some side effects of anticholinergic drugs on the CNS system, such as it can cause the patient to feel confusion and dizziness, even like attention decline. So yeah, that's all for me. Thank you.
Thank you for the answers given. I will give 10 seconds for the judges to take their mark. And let's proceed to the next participant, which is A3 Taylor. So the number of question is number 13. Okay, so the question is, explain the content uniformity test. I repeat, explain the content uniformity test. Your 75 seconds will start from now. Okay, so your time is up. May I know your answer?
Okay, so content uniformity test is basically to ensure that a particular drug, when produced by the manufacturer, every pill, for example, it will contain almost very similar content of their active ingredient, so that the patients, every patient, when they receive the drug, they will get the same similar dosage form, and this can reduce the risk of like inefficacy or increased toxicity. Yeah, so basically is a test to evaluate the dosage form of the drug, and it is very necessary so that to keep the drug in a target range. For example, so a 10 mg drug should not be very different, should be within a range, for example 10% of the weight. And yeah, this can yeah, so this basically to ensure the patient safety and the efficacy.
Okay, so thank you for the answers given. And other universities, do you want to challenge the answers? If you do, you may type challenge in the chat box. In count of 5.
Yeah, I'm
4, 3.
Yeah, I want to challenge. Tap in chat box already.
All right.
Okay, so basically the content uniformity test is to determine the uniform of the active ingredient in the capsule or tablets. So according to USP, right, they will randomly select 30 tablets, and then 3 tablets will assay individually. So the tablets has to 9 tablets has to pass through the test, and the content should not less than 75% and not more than 125% with the label content, the active ingredient. Yeah, that's all. Thank you.
Okay, thank you for the answers given. I will give 10 seconds for judges to answer the question. To take their marks. Thank you. Okay, thank you. Let's proceed to the second question for A3 Taylor. So the number of question is 62. So the question is, define the term prodrug. I repeat, define the term prodrug. Your 75 seconds will start from now. Okay, so thank you. A3 Taylor, you may answer the question.
All right. Okay. So a prodrug is basically a medication, but when a medication which is inactive by itself, however, only after it is administered, it will be activated in the body at the site of action where we want it to be. So, for example, this can be done through the enzyme metabolism, so that the prodrug will become a pharmacologically active drug, and it will exert its action at the site of at the site we want. And so, for example, we have a levodopa where it should act in the CNS, and only when it enters the CNS, it will be activated, so that this can reduce its peripheral or systemic side effect. And there are also multiple ways to formulate a prodrug, such as by using a salt form and some vehicle, or so that we can make the drug only has the effect at the site we want. And yeah, there are also some examples like viral acyclovir, which can be turned to acyclovir. Okay, I think that's from me. Thank you.
Okay, so thank you for the answers. Identities, do you want to challenge the answer given? If you do, you may type challenge in the chat box in count of 5, 4, 3, 2, 1. So UOC A2 want to challenge the answers, so you may switch on your microphone.
Hi. For me, defining the term prodrug means that it is a compound that after administration is metabolized, like the previous answer says, metabolized in the body to be a pharmacologically active drug. The reason we use this is to make sure that the bioavailability is optimal when it reaches the body, and it doesn't cause a very toxic effect to the first pass metabolism organ. And also, like, we have different classification. Recent pro drugs included approved by FDA. It has to be 10% of marketed worldwide can be, there's 10% of it worldwide marketed drugs considered pro drug. And also, like, between recent years, dabigatran, gabapentin, inacalcil, sofosbuvir, tenizolid phosphate, isavuconazonium, and also aripiprazole, Lorexil on 2015, the recent new pro drugs given marketed. Classifications of prodrugs can be divided into two types. Major types includes bioactivated prodrugs inside the cell and also outside the cell. We further branch it down into type 1 and type 2. So type 2, there's ABC. Type 1A happens in bioactivation happens in therapeutic target tissue and cells. For example, antiviral like acyclovir, fluorouracil, cancer drugs such as cyclophosphamide, also like DOPA, also zidovudine, which is also antiviral. Type 1B, which is happening, bioactivation happens in metabolic tissues, such as liver, GI tract, lung, etc. Included drugs are carbamazepine, captopril, cassiloprolol, and heroin. That's type 1A and type 1B, and type 2A, which is extracellular bioactivation. Type 2A is GI fluids, which includes drugs like sulfasalazine and also loperamide oxide. And also type 2B, systemic circulation and other extracellular fluid compartments. Included are the acetylsalicylate, which is aspirin, and also chloramphenicol antibiotic, phosphenicoin, and also like type 2C, which is bioactivation happens at the target tissue and cell, extracellular, like I repeated. So yeah, sorry to drag that one. That's all about the project definition.
Thank you. I will give 10 seconds for judges to take their marks. So let's proceed to the next participant, which is A3UOC. So A3UOC, okay. So the question is 56. The number of question is 56. The question is, in IR spectroscopy, the spectrum is divided into 4 general regions. Write those 4 regions. I repeat, in IR spectroscopy, the spectrum is divided into 4 general regions. Write those 4 regions. For 75 seconds, we start from now. Your time is up. You may switch on your microphone to answer the question.
Hi. So the 4 general regions that are available in the IR spectroscopy, in the spectrum, sorry. So first is the single bond stretch region. So this region consists of a functional group with a wave number of 400 to 300 centimeter, -1. The second one will be triple bonds, which will be from the wave number 2500 to 2000. And then the double bond region will be from 2000 to 2500. And the fingerprint region on the skeletal vibration will be from the wave number 1500 to 500. So example of single bond stretch function will be the OH groups. Triple bonds will be the nitriles, and the double bond will be C double bond O's, and the fingerprint region will be C with single bond O's. So in the fingerprint region and double bond region, we have the bending and rocking. So that's why they be classified under the double bond and the fingerprint region. Yeah, that's all for the 4 regions. Thank you.
Thank you for the answer given. Other universities, do you want to challenge the answer given? If you do, you may type challenge in the chat box in count of 5, 4, 3, 2, 1. So there is no one to challenge. I will give 10 seconds for judges to take their marks. Okay, for the next question for the same participant. So the question is number 52. 52. The question is, a 52 years old patient was started on methotrexate regimen and naproxen for rheumatoid arthritis. Describe the monitoring plans for him. I repeat, a 52 years old patient was started on methotrexate regimen and naproxen for rheumatoid arthritis. Describe the monitoring plans for him. Your 75 seconds will start from now. Okay, so you may answer the question.
Okay, hi. So the naproxen, so in this patient, naproxen may actually increase the blood levels of methotrexate. So the patient is more likely to experience this interaction if they have kidney disease or are receiving a high dose of methotrexate. So the risk may be less if they are using the methotrexate once a week to certain forms of arthritis, but it's important to monitor the blood cell counts and kidney and liver function and it has to be done regularly within the intervals during the methotrexate therapy. So a methotrexate test may also be ordered whenever a person has symptoms or signs that suggest methotrexate toxicity. So over-the-counter pain relievers such as acetaminophen, ibuprofen, naproxen acetaminophen ibuprofen is actually generally safe to take with methotrexate. Just a minute. So the one of the most common toxicity will be the GI problems such as nausea and vomiting associated with methotrexate. It affects about 20 to 65% of our rheumatoid arthritis patients who take the drug, and up to 1/3 develop mouth ulcers and sores, and many also complains headaches, fatigue, and also the overall kind of overwhelming feelings as well. And NSAIDs should not be administered before or concurrently with high dose of methotrexate, because concomitant use of these NSAIDs and high dose methotrexate has been reported to increase and prolong the serum methotrexate concentration, and which is why I mentioned this now, it actually causes the GIT and also the hematological toxicity. So yeah, that's all from me.
Thank you for the answer. Other universities, do you want to challenge the answer given? If you do, you may type challenge in the chat box in count of 5, 4, 3, 2, 1. So there is no one to challenge. I will give 10 seconds for judges to take their marks. Okay, so let's proceed to the next participant, which is A4IMU. So for the first question is, number 28. So the question is, explain patient factors which are associated with a high risk of non-adherence towards medication intake. I repeat, explain patient factors which are associated with a high risk of non-adherence towards medication intake. Your 75 seconds will start from now. Okay, so may I know your answer?
Yep. Okay. So the factors that could contribute to a high risk of non-adherence towards medication intake. So there's a few. So the first one would actually be the first step is disease, where there is a lack of symptoms. If there is no symptoms, then the patient might not be aware of the disease, and they would be feeling like they is feeling better. So they would not, not take the medications. And then another is also age. When there is a higher age of the patient might be forgetful to take the medication. And then next is polypharmacy. When there is a higher number of medication needed to be taken by the patient might be it will lead to non-adherence. And then the next thing would be a level of education. So the lower level of education will actually lead to different beliefs and attitudes towards the disease and medication prescribed. So
if the patient believes that doesn't believe in the medication, then it will also lead to a non-adherence. And then there's also another factor, which is a low social economical status, where the patient is unable to afford the medication, so it will also lead to a non-adherence. Yeah, that's it for me.
Thank you for the answer. So other universities, do you want to challenge the answers given? If you do, you may type challenge in the chat box in count of 5, 4, 3, 2, 1. So IIUM A3 want to challenge the answers given. So you may switch on your microphone.
Thank you. So some of the patient factors that are associated with a higher risk of non-adherence towards medication intake include forgetfulness, especially if the patient is of older age, where the memory is a very prevalent problem, or if the patient lives alone or doesn't have anyone to remind him of the schedule, and especially if the patient is on polypharmacy disease, which need many types of medications all day long. Second patient factor includes occupation. If the patient's occupation keeps him busy from taking the medication, so the patient will not be adherent. Also, belief, especially if the said medication counters his personal or religious beliefs. For example, some patients may believe in the efficacy of traditional medicines compared to conventional modern medicine. The fourth patient factor is low socioeconomic status, in which especially if the patient is on advanced stages of disease, where they need many types of medications with high prices, not usually prescribed, so they won't have the means to get the medicine and take them accordingly. And also, if the fifth patient factor is if the patient lifestyle needs him to be always alert and the medication and medications diversified medication side effects prevents him from having this normal lifestyle. For example, if the medicine makes him drowsy, or the medicine makes him or the medicine disturbs his usual lifestyle, then the risk of non-adherence towards medication intake will be increased. So I think that's all for my answer. Thank you.
Thank you. Thank you for the answer. I will give 10 seconds for the judges to take their marks. Okay, so let's proceed to the second question for A4IMU. So the question number is 29. 29. The question is, describe the advantages of wet granulations. I repeat, describe the advantages of wet granulations. Your 75 seconds will start from now. Hello, why the time is not moving? Okay, so the time is up.
Okay. Okay. So the advantages of wet granulation, the first thing is wet granulation actually modifies the properties of the formulation ingredients, so it can overcome their tabulating deficiency. So granules formed using wet granulation is actually relatively more spherical than the powders and have a better flow property. And the next advantage is that it improves the compressibility of the powders and allows the use of low pressure during the compression because the wet granulation allows the use of low pressure during compression. And actually this will reduce the machine wear and improve the life of the machine. So this is the second advantage. The next advantage is the wet granulation make use of the conventional excipients and therefore it is not dependent on the inclusion of special grades of excipients. And the next advantage is that it ensures it produces a better content uniformity, especially for the soluble low dose drugs. And then the next advantage is that it improves the dissolution rate of poorly soluble drugs. It does this by imparting the hydrophilic properties to the surface of the granules. And the next is it prevents segregation of components of the homogeneous powder mix during the processing, the transferring, the handling, or the storage. So it can decrease the intra or inter-batch variability. And next, the tablets produced through wet granulation is amendable to post-processing unit operations. For example, the process such as tablet coating. And then next is it reduces the level of dust present during the manufacturing process. This can reduce the cross-contamination and to the risk of the workers. Lastly, it reduces the amount of air entrapment and increase the powder compressibility. Yeah, that's it.
Okay, thank you for the answer. Other universities, do you want to challenge the answer given? If you do, you may type challenge in the chat box in count of 5, 4, 3, 2, 1. So there is no one to challenge. I will give 10 seconds for judges to take their marks. Okay, let's proceed to the next participant, which is A3IIUM. So the question is number 37. 37. So the question is, A, most products that are used to fill capsules are formulated as powders. Why is uniform filling important? B, name 2 properties of the powder formulation should possess in order to ensure uniform filling. Name the excipients that can help to achieve such properties. I repeat, A, most products that are used to fill capsules are formulated as powders. Why is uniform filling important? B, name 2 properties of the powder formulation should possess in order to ensure uniform filling. Name the excipient that can help to achieve such properties. Your 75 seconds will start from now. The time is up. May I know your answer?
All right. So the first sub question: what is uniform filling for powder capsule is important to ensure that all of the capsules produced in the batch have uniform dosage of API put into the capsule. So why is this important? Because to reduce the variability of the effects of the variability of the efficacy of the capsule product. So every capsule, every capsule in the batch produced will produce the same, it will achieve the same efficacy of the effect intended throughout all patients. And the second question, name two properties of the powder formulation that the powder should possess is firstly good powder flow. So this is to ensure that there is no residual powder that is stuck in the machine or the funnels that is used to fill the capsules. So excipient that can help with this good powder flow is glidants such as silica top. The next property is the powder should have good cohesion between the particles, aka the interparticular force. So this is to ensure that the powder throughout the formulation process does not form lumps or does not form lumps which will increase the friction and disturb the flow of the product. So the excipient that can help with good powder cohesion is binders such as gelatin and starch. That's all for my answer.
Thank you for the answers given. Other universities, do you want to challenge the answer? If you do, you may type challenge in the chat box in count of 5, 4, 3, 2, 1. So there is no one to challenge. I will give 10 seconds for judges to take their marks. Okay, let's proceed to the next question for A3IIUM. So the number of question is number 50. 50. The question is, state why a combination of drugs may be beneficial in drug therapy to treat a specific disease or condition, and give example of such combinations. I repeat, state why a combination of drugs may be beneficial in drug therapy to treat a specific disease or condition, and give example of such combination. Your 75 seconds will start from now. Okay, so the time is up. May I know your answer?
So the question, why a combination of drugs may be beneficial in drug therapy to treat specific disease? Firstly, in case of the infectious diseases, we want to reduce resistance towards a particular pathogen. For example, usual combination of antibiotics is amoxicillin and clavulanic acid, because amoxicillin is the penicillin that target the gram-positive bacteria, and clavulanic acid is the beta-lactamase inhibitor, which inhibits the beta-lactamase in the particular pathogen, so to reduce the resistance towards the amoxicillin. Next, to ensure adherence, this is particularly important in case where the disease need to be treated with many drugs. For example, hypertension. For treating hypertension, the usual formulation include angiotensin receptor blockers such as losartan, and thiazide diuretics such as hydrochlorothiazide. So the patient will not have to take separate tablets or separate formulations in the same day, so they can save their time and improve adherence and not be forgetful. Also, the combination of drugs may be beneficial in case and to target the different pathways of the disease. So this is to increase the efficacy of the effect intended in the patient. For example, again, hypertension, we can increase the efficacy and reduce the dosage, dosage needed for a single product. For example, we want to achieve lowering the blood pressure in hypertension, so we give the combination of diuretics, thiazide diuretics, hydrochlorothiazide, and angiotensin receptor blockers such as losartan, because these two medications target different pathways in the hypertension, so the effects can be much larger. And the next reason is that we want to increase the coverage of the pathogens involved. Increase the coverage of the pathogens involved. For example, in urinary tract infection, there are many possible pathogens that can cause UTI. So we want to increase the coverage towards. We use broad spectrum antibiotics such as gentamicin and sulfonamides for empirical therapy to ensure that we can cover all possibilities of the pathogens involved. So that's my answer. Thank you.
Thank you for the answer given. Other universities, do you want to challenge the answer? If you do, you may type challenge in the chat box in count of 5, 4, 3, 2, 1. So there is no one to challenge. I will give 10 seconds for judges to take their marks. Okay, let's proceed to the last participant from Taylor, which is A for Taylor. So the first question is, '63. So the question is, how hemorrhage reduce cardiac output? I repeat, how hemorrhage reduce cardiac output? Your 75 seconds will start from now. Okay, so may I know your answer?
Okay, so for this question, how HMOH reduce cardiac output? So firstly, HMOH will lead to a reduce in blood volume during acute blood loss, which cause a fall in central venous pressure and cardiac filling. So this leads to a reduced cardiac output and arterial pressure. So the body will have a number of compensatory mechanisms that become activated in an attempt to restore the arterial pressure and blood volume back to normal. So these mechanisms consist of, for instance, the first one is baroreceptor reflex, second one is chemoreceptor reflex, the third one is circulating vasoconstrictors, fourth one is renal reabsorption of sodium and water, fifth one is activation of thirst mechanisms, and the fifth one is reabsorption of tissue fluids. So this may lead to the body can quickly sense a fall in blood pressure through its arterial and cardiopulmonary bioreceptors, and then it will activate the sympathetic adrenergic system to stimulate the heart, such as increasing the heart rate and contractility. Besides that, you also constrict the blood vessels, such as increasing the systemic vascular resistance, which leads to the reduced in blood volume and cardiac output.
Thank you for the answer. Other universities, do you want to challenge the answer given? If you do, you may type challenge in the chat box in count of 5, 4, 3, 2, 1. So UOCA2 want to challenge the answer. You may switch on your microphone to answer the question.
Okay, so basically, hemorrhage is an incidence where blood loss suddenly appears inside the body, which results in sudden drop in BP, blood pressure, which is hypertension, can cause. First of all, body reacts by a couple of compensatory mechanisms, including baroreceptor reflexes, chemoreceptor reflexes, vasoconstrictions, which is short term, and also long term, including RAS system, also renal reabsorption of sodium and water, activation of thirst mechanism, reabsorption of tissue fluids. But then as blood loss progresses, hemorrhage, the sympathetic activation might not be able to cover that up. So the blood loss continues, and also like when it's not sufficient to the blood flow is not sufficient to the organs, then heart is especially affected, because heart, as we know, that cardiac output is how hard the heart pumps each volume of blood. The flare dictated by Frank-Starling laws of the heart, the cardiac output is related to the end diastolic volume, a component of cardiac preload. For this reason, adequate cardiac venous return is vital to ensure appropriate perfusion. But in this case, due to the sudden drop and unable to decompensate the drop in venous return, the heart will react via the lack of pressure against the wall by pumping with lower pressure. So cardiac output is reduced, and in this case, yeah, we managed to link. It is due to drop in venous return, thus drop in cardiac output. Thank you.
Thank you for the answer. I will give 10 seconds for the judges to take their marks. Okay, let's proceed to the second question for A4 Taylor. So the question is 23. The question is, how inspiration and expiration contribute to increased cardiac output? I repeat, how inspiration and expiration contribute to increased cardiac output? Your 75 seconds will start from now. your time is up. May I know your answer?
Okay, so for this question, how inspiration and expiration contribute to the increase in cardiac output? So firstly, I will talk about inspiration. So inspiration will lead to a drop in the intrathoracic pressure, which then it will dilate the thoracic vena cava and actually decrease the atrial filling. So the cardiac output will start to fall, and consequently, the arterial pressure will start to fall as well. Therefore, the drop in arterial pressure reduces the stretch on the arterial baroreceptors, causing a reflex increase in the heart rate. So for the second one is for expiration, which is the act or process of releasing air from lungs through the nose or mouth. So during expiration, the lung deflation will cause the flow to increase from the lungs to the left atrium, which will further increase the left ventricular filling. The net effect of an increased rate and depth of respiration will lead to an increase in the left ventricular stroke volume and the cardiac output. So that is all from me. Thank you.
Thank you for the answer. Other investees, do you want to challenge? If you do, you may type challenge in the chat box in count of 5, 4, 3, 2, 1. So there is no one to challenge. I will give 10 seconds for judges to take their marks. Okay, thank you. Okay, let's proceed to the next participant, which is A4UOC. So for the first question is, number 24. 24. So the question is, explain which molecules among N2 and HCl are IR active. Give your reason. I repeat, explain which molecule among N2 and HCl are IR active and give your reason. Your 75 seconds will start from now. Okay, so may I know your answer?
Hi, okay. The answer for this one, explain, is homonuclear diatomic molecules such as H2, N2, and also O2 has no dipole moment and are IR inactive, while heteronuclear diatomic molecules such as HCl, NO, and also CO do have dipole moments and have IR active vibration. In order for a vibration mode to absorb infrared light, it must result in a periodic change in the dipole moment of the molecule. Such vibration said to be infrared active. In general, the greater the polarity of the bond, the stronger its IR absorption. Some kind of vibration infrared emit. So yeah, that's what it is.
Okay, thank you for your answer. Other universities, do you want to challenge the answer given? If you do, you may type challenge in the chat box in count of 5, 4, 3, 2, 1. So Taylor University A2 want to challenge the answers. So you may switch on your microphone.
Okay, so the answer to this question is actually HCl. This is because HCl does has a dipole moment. So stretching of the HCl bond actually leads to a change in the dipole moment. And so because of this dipole moment of HCl changes during a stretching vibration, it actually absorbs infrared radiation. So when two atoms of the diatomic molecule are having different electronegativity, they will generate this dipole moment that I mentioned just now. So molecule with this dipole moment actually absorb the radiation from infrared region and set the vibration motion due to the fluctuation in the bond. So this will actually increase the vibrational energy. So such molecule, we can call it as IR active. So this simple diatomic linear polar molecule have only one mode of vibration. So therefore, we can say that this heteronuclear polar molecule like HCl are actually IR active, while the N2 is a homonuclear non-polar molecule with symmetrical structure. So it does not possess any dipole moment. So we can call it as IR inactive. Yeah, that's all from me.
Thank you for the answers given. I will give 10 seconds for judges to take their marks. Okay, so let's proceed to the second question for A4 UOC. So the number of question is 44. 44. So the question is, give one example of combined oral contraceptive and the advantages and disadvantages of this preparation. I repeat, give one example of combined oral contraceptive and the advantages and disadvantages of this preparation. Your 75 seconds will start from now. Hello, the time. Hello, Sharon. Okay, thank you. Your time is up. May I know your answer? All right.
Give me a second. Okay. The combined oral contraceptive pill (COCP), also referred to as the birth control pill and or colloquially as the pill. It is a type of birth control that is designed to be taken orally by women, and it includes a combination of estrogen, usually ethinyl lestradiol, and also a progestogen, specifically progestin. And the advantage of this is the no interruption of foreplay or intercourse, reduce bleeding and cramping with periods, reduce pain during ovulation, reduce risk of pelvic inflammatory disease (PID), reduce fibrocytic breast changes, and may reduce acne also. And also the disadvantage is does not protect against sexually transmitted infections or HIV, may not be as effective when taken with certain medicines. And the next one may delay return of normal cycles, and a pill must be taken every day. And then the next one is patches may not fully protect you from pregnancy if they are exposed to direct sun or high heat. This can release a high dose of hormone from the patch, which leave less of the patch to release later in the week. And example of this combined oral contraceptive is the Loestrin 20. So that's all from me.
Okay, thank you. So are the MCs, do you want to challenge the answers given? If you do, you may type challenge in the chat box in count of 5, 4, 3, 2, 1. Sorry, there is no one to challenge, and I will give 10 seconds for judges to take their mark. Okay, so next participant is A5IMU. So for the first question, number 35. So the question is, state stages of changes in the trans-theoretical model. I repeat, state stages of changes in the trans-theoretical model. Your 75 seconds will start from now. Okay, so your time is up. You may answer.
Okay, so the trans-theoretical models, also known as stages of change model, so is evolved through studies examining the experience of smokers who want to quit on their own with those require further treatments to understand why some people were capable to quitting the smoking on their own. So there are total 6 stages in this model. The first is pre-contemplation. Second is contemplation, preparation, action, maintenance, and termination. The pre-contemplation, in this stage, people do not intend to take action in foreseeable futures. People are often unaware their behavior is problematic and produce negative consequences. People in this stage often underestimate the pros and changing behavior and place too much emphasis on the cons of changing behavior. And the second stage is contemplation. In this stage, people are intending to start a healthy behavior in a foreseeable future. The people recognize that the behavior may be problematic, and more thoughtful and practical consideration of pros and cons of changing the behavior take place with the equal emphasis placed on both. Okay, the third stages is preparation. So in this stage, people are ready to take action within the next 30 days. People start to take the small step towards the behavior changes, and they believe changing in their behavior can lead to a healthy lifestyle. And then next stage is the action. So they take the action to change their behavior, and then after that they will maintain it for at least more than 6 months. And the last stage is termination. So the people don't desire to back to the unhealthy behavior. They are successful to stop the smoking. Yeah, that's all. Thank you.
Okay, so thank you for the answers. Adi Yusti, do you want to challenge the answer given? If you do, you may type challenge in the chat box in count of 5, 4, 3, 2, 1. There is no one to challenge. I will proceed to the second question. So the second question, the number is 60. 60. So the question is, a patient is referred to a cardiologist and is diagnosed with atrial fibrillation. The patient starts oral warfarin therapy, but is concerned about the potential risk of bleeding complications and the need for frequent anticoagulation monitoring. Describe available alternative to warfarin therapy, including the risk of adverse effect and monitoring. I repeat, a patient is referred to a cardiologist and is diagnosed with atrial fibrillation. The patient starts oral warfarin therapy, but is concerned about the potential risk of bleeding complications and the need for frequent anticoagulation monitoring. Describe available alternative to warfarin therapy, including the risk of adverse effect and monitoring. Your 75 seconds will start from now. Okay, so your time is up. May I know your answer?
For warfarin, if the patient take the warfarin right, they hard to find the right balance. For example, if they take the foods such as the spinach, so they have to adjust the dose. So they have to measure the INR frequently. But if they change to an alternative to warfarin such as the dabigatran, so they no need to measure the INR so frequently. So but this dabigatran, you have to also monitoring the bleeding side effect, so the nose bleeding, and also they might cause the nausea, abdominal and stomach pains, stomach upset, indigestion, heartburns also. And the routine monitoring is not required compared to the warfarin. Normally they can need to assess the renal function once a year, and they have to monitoring the complete blood counts, protomin times once a year, and most importantly, they have to closely observe their sign of bleeding or anemia. So the prophylaxis, right, for this dabigatran, they can use in the so the dosage form for this dabigatran is 150 mg twice daily. Yeah, that's all.
Thank you for the answer. Ade Mistis, do you want to challenge the answers given? If you do, you may type challenge in the chat box in count of 5, 4, 3, 2, 1. So there is no one to challenge. I will give 10 seconds for judges to take their marks. Okay, so let's proceed. Let's proceed to our last participant for semi-final, which is A5 IIUM. So for the first question, the number is 36. So the question is, describe 5 ways to reduce errors during drug prescribing and drug administration for pediatric patients. I repeat, describe 5 ways to reduce errors during drug prescribing and drug administration for pediatric patients. Your 75 seconds will start from now. Okay, so your time is up. A5 IIUM, what is your answer?
So thank you. So the first one is, so describe 5 ways to reduce error during drug prescribing is, first thing we need to consider the children BSA, body surface area, because children has low distribution, and this is important indicator because the children tend to have overdose. So the second one is the 5R, which is must give the right dose, right route, right medication, right time, and to the right patient. The next one is the prescriber must write a clear instruction to the caregiver. And lastly, the doctor must clearly write the medication that he want to prescribe. So I think that's all from my answer.
Okay, thank you. Other universities, do you want to challenge the answer given? If you do, you may type challenge in the chat box in count of 5, 4, 3, 2, 1. So there is no one to challenge. I will give 10 seconds for judges to take their marks. Okay, for the last question, the number for the question is number 7. The question is, state the function of bicuspid valve. I repeat, state the function of bicuspid valve. Your 75 seconds will start from now. Okay, so your time is up. May I know your answer?
Okay, so what is the function of bicuspid? The function bicuspid valve is located at the left side of the heart. So the function is to prevent backflow of the blood, and this is important as we want to prevent the mix between oxygenated and deoxygenated, as the mix of the blood will cause hypoxia. I think that's all from me.
Okay, so thank you for the answers given. Other universities, do you want to challenge the answer? If you do, you may type challenge in the chat box in count of 5, 4, 3, 2, 1. So UOC A2 want to challenge, so you may switch on your microphone to answer.
Okay, hi. Basically, bicuspid valve is located at the left side of the heart, situated between left atrium and left ventricle, preventing blood from re-entering the aorta when the left ventricle is contracting, and also allows blood to flow in the right in one direction in the left side of heart from left atrium and to left ventricle to the systemic circulation, so to ensure oxygenated blood leaves and perfuse all the organs needed in all over the body, and also prevents, as I said, prevents backflow of blood into left atrium when the left ventricle is contracting, And it also prevents blood from entering pulmonary artery when the right ventricle is contracting. And yeah, that's all.
Thank you for the answer. I will give 10 seconds for judges to take their marks. Okay, so this semi-final round has already reached the end. Thank you, Team A of Taylor's University, UOC, IMU, and IIUM for giving your best effort to answer all of the questions that were given to you. Also, thank you to the judges, Dr. Shamin, Dr. Nafis, Dr. Nurul Ain, and Dr. Abdullah Khan for joining us today in the semi-final round. With that, thank you very much.
Excuse me, can judges stay here for a period?
All right.
Participant can leave the meeting room.